crisis continues at alarming levels. It reported over 311,000 new cases in a day. The Indian capital has announced it is setting up oxygen concentrator banks for patients in home isolation and intensive care units. Now, the African continent heavily relies on India for specialized treatment, surgical operations, and the supply of medication. But with India battling the world's largest surge in COVID-19 cases, healthcare in Africa and Kenya in particular is feeling the heat too. CGTN's Inox Kolia reports.
It's now evident that the COVID-19 situation in India is heavily affecting the African continent, with many patients being forced to seek specialized treatment elsewhere.
I wanted to go to India. I really wanted to go to India because
John Otanga is a freelance videographer with a Kenyan TV station. He has battled blood cancer for the last decade, and doctors have advised him to conduct a bone marrow transplant. India was his choice.
we thought the pandemic in India was going to be done maybe soon, but now it's taking longer than we expect. And for me, I need the treatment as soon as possible.
And that has forced him to look for treatment closer home, Egypt.
We didn't know so much about Egypt. At this point, we are just trying to find somewhere. You can see the rates, because in India we were given the treatment plan. We knew the cost. It was only for us to try and collect our funds and getting ready for everything, since we had all the details concerning the treatment and the accommodation.
I'm Idred.
Dr. John Mwangi is a consultant surgeon based in Nairobi. He says India's health crisis has a far-reaching impact on the African continent.
It also affects the pharmaceutical industry because we rely a lot on medications that we import from India, including the vaccine itself. You know, we got the first dose, but we have not managed to get the second dose because there are limitations in production and availability, access.
India's temporary ban on COVID-19 vaccine exports is slowing Africa's inoculation efforts. Most countries were relying on jabs from the Serum Institute of India. According to Dr. Mwangi, India's COVID-19 crisis should be a wake-up call for the African continent. He says governments need to invest in healthcare, from infrastructure development to specialized training of healthcare workers.
And now people are opening their eyes and seeing what are the local resources, what is infrastructure, what is the capacity, what can be done locally.
John Otanga agrees.
It can be done in Kenya as long as we have the required facilities.
For John Otanga,